And the project I'm going to present is about the effectiveness of a biopsychosocial multidisciplinary intervention by the role of fear avoidance belief in non-specific subacute low back pain. Low back pain, as we know, is a common condition with multifactorials with individual and social impact. It affects around 80 and 85 of the general population, and it has a global prevalence of 17 to 32%. In Spain, it's about 20% in the last 5 years. Also, we know that psychological factors plays a large role play overall at early stages, and clinical should focus on those factors as well. We adopt the subacute low back pain definition by a duration between 2 and 12 weeks, according to the literature. So early multidisciplinary treatment strategies could be applied to research and improvement in a fear avoidance belief with a positive effect in the evolution of low back pain. The research question was to evaluate the effectiveness of a biopsychosocial multidisciplinary intervention through the changes in the FAB, that is the fear avoidance belief, in working population in subacute non-specific low back pain, compared to the usual care at 3 and 12 months. The methodology, it was a cluster randomized clinical trial conducted in 39 primary healthcare centers in Barcelona and around. It was participants between 18 and 65 years old. The samples was 39 primary care healthcare center, about 369 participants, and the two arms of this study was the control group with 26 primary healthcare centers and the intervention group with 13. The main outcome was the questionnaire of the fear avoidance belief, and the assessment was at baseline 3 and 12 months. The analysis was by intention to treat and analysis blind, and the analysis was with multiple imputations. The component of the intervention, in fact, was 10 hours in total. That it was 2 hours with a GP or a nurse that involves any doubt of the patient that it has, the pharmacology part, the therapy, and the same physiotherapists and psychologists in all the primary healthcare centers with expertise in intervention groups that developed the intervention 4 hours each, that it was implemented in different schedules according to the patient's facilities. And the control group received our clinical practice guidelines of a lumbar spine disease in adults. The fear avoidance belief questionnaire, it's a questionnaire that involves 16 items, each item 0 to 6 points, that involves that 0 is that the patient has no problem, that he believes that the pain is not is not related with the physical activities or the work, and 6 points that the patient relates his pain with any physical act or in his work. The range is 0 to 96, and we take the lowest score if it's lower 50%. It has two scales. That one is the fear avoidance belief questionnaire with work that includes 7 items, 7 questions of the questionnaire. That range is 0 to 42, and according to some research, we take that a low score is meaning that is lower than 20, including 20, and the other scale is about the physical activities that involves 4 items, and the range was 0 to 24. And the lowest score, we take it like less, including 14. In the results, we have that at the end of the 3 months, we had 80% of the sample, and at the end of 12 months, we have 72% of the sample. The mean age was 45, and it was 61% of were women. At the baseline, there was no difference at all. And the preliminary results with the FAB, we could see that in the FAB questionnaire, in the total questionnaire, we can see that there was a statistical difference. It could be with a it was better at long term. And in the physical activities, we can see that there was difference in both in the intervention group, but at the work, that was presented just at 12 months. Well, it's that there was a statistical significant difference in the FAB, as well in the physical and the work, better results at long terms, and the physical performs. It maintains with significant difference, but at work and the FAB work, it just seems at 12 months. In a conclusion, we can take a consideration that a multidisciplinary biopsychosocial intervention shows a positive effect in the fear avoidance belief, and the intervention could improve that if we get better in fear avoidance, we can make a result just in the daily days and at work as well. Thank you.